Welcome to Winning Wednesday. This month has been such a great opportunity for everyone who is trying to get their nursing license. We will be going over the topic NSAIDS on today. Hi, everyone. My name is Professor Regina, the #1 NCLEX instructor on the planet. Right now, I am in Uganda, and I am really excited about the nursing classes and NCLEX training that is happening right here in this amazing country, and also about the things that are coming up. So guess what we have going into the month of June? Remar Nurse University, and we are focusing on pharmacology. We're focusing on pharmacology. Hey, everybody, let me tell you about amazing Remar Nurse University. But first, really quickly, you're going to want to remember this. This is how you sign up for Remar Nurse University. And it's important that you sign up because that is when you will get the schedule, the workbook. Every Monday, the class will open up to go over something about pharmacology. I'm going to get more in detail in a minute. But to sign up for Remar Nurse University, if you're excited, go to www.remarnurse.com/RNU. Okay, /RNU. And the reason why we focus on pharmacology is because it is probably one of the most misunderstood categories, most failed probably categories in the NCLEX. And it's just because most students struggle, not because they didn't try, but because they didn't have the right study method for pharmacology. So that's one of the reasons why we always do pharmacology. Also in June, it really sets the tone for what happens the rest of the summer. So if we just right off of the bat attack pharmacology, then you can continue to build on the things that you learned in Remar Nurse University to help you understand this topic. And then medications will always be on NCLEX. Always going to be on NCLEX. So there's never a bad time to study pharmacology, because for sure, when we look in the back of Quick Facts for the pharmacology section, everybody who has Quick Facts certainly should be looking at the pharmacology section. So if you're studying the medications from here, then this will be further support to help you along the way. So just got to do a reminder that for the month of June, we will be doing Remar Nurse University. Sign up for it, okay? Pharmacology is the focus. And if it's an area of struggle, this is your opportunity. Oh, another thing that I've been asking, is it for nursing students, or should you only be NCLEX, or I'm just starting nursing school? All will benefit from this course. Whether you're just a beginner, because you will be learning the language, you will see how nurses use it, you will see how the scenarios that happen from it in this course. If you're in nursing school, flat out, you have to understand these principles as you grow into your knowledge base. And then if you're studying for NCLEX, this will probably be a last minute refresher or a good refresher course for you. So everybody is welcome to this course. All right, we're going to get into the NSAIDs. Of course, this is pharmacology. So this goes right along with Remar Nurse University. We are talking about substances that are going to alter the body's pain receptors. Now, NSAIDs are non-anti-inflammatory drugs. These are non-opioid analgesic medications. And so we're using these medications to treat pain, also reduce inflammation, and lower the patient's temperature. Now, there are many different types of NSAIDs available. Some you can get them over the counter. Others you can get them with a prescription only, Now, when you may ask, okay, why are NSAIDs on the NCLEX? It is because not only do NSAIDs treat a wide variety of conditions, pain, inflammation, right? They are used across the board in almost all specialties. So whether you're a renal nurse or whether you are a surgical nurse or a pediatric nurse, you need to know, definitely med-surg, of course, you need to know NSAIDs. You need to know NSAIDs. Here's a question. This is select all that apply. Which form of NSAIDs are available for clients to buy without a prescription? Select all that apply. Come on in and give me the answers to these questions. Tablets or capsules. Number 2 says liquids. 3, creams or gels. 4, injections. And 5, suppositories. What are we saying here? So the correct answer is going to be what? It's going to be what? Correct answer is going to be boom. You can get the NSAIDs without a prescription if it is a capsule, if it is a liquid, if it is a cream, if it is a suppository. Check those out. Make sure you write this down because you do want to know this. All right, now, warning signs for NSAIDs. And now these are going to be things that we have to look out for or teach our patients to look out for. So that is going to be bloody or black tarry stools. That is going to be cloudy urine, hematuria, severe stomach pain, changes in urine, unusual weight gain, or jaundice. Now, as a nurse, you should know what each of these clinical signs represent. So black or bloody or black tarry stools. What does that mean for you? What does it mean if the patient has jaundice? Okay. Other warning signs, if your patient on an NSAID has blurred vision, tinnitus, photosensitivity, a severe headache, difficulty speaking or thinking. Now, I'm reviewing these principles, but my expectation is honestly that you already know them. NSAIDs are contraindicated in the following clients: somebody with NSAIDs or salicylates hypersensitivity, anybody who underwent a coronary artery bypass graft surgery, pregnant clients with acute kidney injury, or children and teenager with viral infections. And this is with or without fever. They should not be given aspirin or aspirin containing products. If you know why, put it in the comments. If you don't know why, go to the comments. Okay, this is our study session. Now, you might want to write these down because in the quick facts, it doesn't specifically list out different types of NSAIDs, but these are the names here. You have ibuprofen, naproxen, very popular, ibuprofen, naproxen, aspirin, celecoxib, and indomethacin. These are types of NSAIDs that your patient will either be prescribed or they will be able to buy at the general pharmacy store or grocery store. Now, if we are talking about pharmacology, it is an important part, but there are many other aspects of your NCLEX training that you need to be able to manage. And so I don't want you to feel overwhelmed. I don't want you to feel unsupported. I want you to have a daily study schedule. And that is why all of those things are built into the V2. The V2 is my NCLEX training system that I use to help nurses pass NCLEX on their first try. So what you see is what you get. You're going to get 2 physical books. Okay, you're going to get access to my lectures, and you'll also get the very important CAT exams and NCLEX Q Bank. This is a phenomenal program that will give you structure, that will give you clarity, but more importantly, a path to get to your nursing license quicker. How about we do some NCLEX questions? NCLEX questions. And The first one, boom, boom. The first one is this. Question number 1. A nurse is caring for a client who is taking ibuprofen for pain relief. Which safety precaution is the highest priority? Number 1, teaching the client the side effects of the medication. 2, administering the medication without food. 3, assessing the client's allergies for opioid pain relievers. 4, monitoring the renal function of the client. These are all great priorities. These are all good safety points, but NCLEX is asking, what is the highest priority? Were you able to stick with this question? Correct answer, pow, number 4, monitoring the renal function of the client. Yeah, this is going to be important. Ibuprofen is known to be nephrotoxic, particularly in high doses or with prolonged use. So therefore, monitoring the client's renal function is the critical safety precaution when administering the medication. There you go. How about this question, number 2? A nurse is caring for a pediatric client who presents with symptoms suggestive of Reye's syndrome after taking ibuprofen for fever. What is the nurse's priority action? Is it number 1, notifying the healthcare provider immediately? 2, initiating continuous cardiac monitoring stat? 3, providing supportive care, including maintaining fluid balance? 4, assessing the pancreas function of the client. So we have a patient here. They have symptoms that are indicative of taking ibuprofen for a fever. Okay, so Reye's syndrome, ibuprofen for a fever. What is the priority action here? Number 1, notifying the healthcare provider. 2, initiating continuous cardiac monitoring, stat. 3, providing supportive care, including maintaining fluid balance. Or 4, assessing the pancreas function of the client. Oh, so good here. Correct answer is going to be number 1, notifying the healthcare provider immediately. Immediately. Very, very important, because this is a serious condition, even though it is rare, but you have to notify the doctor so that you're able to do what needs to be carried out in order to help this patient. Okay, next question. Question number 3. The nurse prepares ketorolac 30 milligrams IV for a client with severe lower back pain. Before giving the medication, the nurse asked the client about a history of allergies. The client mentioned that she had allergic reactions to aspirin before. What should be the nurse's course of action? Number 1, give the client an antihistamine before giving ketorolac. 2, hold the medication and inform the physician. 3, assess a skin testing before giving the medication. 4, give it intramuscularly instead of intravenously. 1, 2, 3, or 4. What do we say? The correct answer is number 2. We need to hold the medication and inform the physician, okay? Because the client said she had allergic reactions to aspirin before, okay? So if the client is sensitive to any NSAID, care must be taken of other NSAIDs because they're in the same class. So we got to be very careful with that for our patients. Okay. Now, question number 4 is this. I like this one so much. A nurse is assessing a client who has developed an allergic reaction after taking ibuprofen. The client is in shock. After determining the client's airway is patent, which action should the nurse prioritize as the highest medical priority? Number 1, intravenous access for fluid resuscitation. 2, administering dialysis to reverse the allergic response. 3, assessing vital signs, including heart rate and blood pressure. 4, providing oxygen therapy to support respiratory function. This one is tricky here because your patient, the first thing we usually could say is check the airway, but now the airway is already checked. So what's the second priority? And these are the next type of questions that are coming up. The second priority. All right, let's see. Correct answer is, boom, number 1. Patient is in shock. So we know after ensuring that the airway is clear and the client is stable, the next medical priority is initiate IV access for fluid resuscitation. So this is important in allergic reaction management because we need to stable the blood pressure. And we know in shock, blood pressure goes down, heart rate goes up. Okay, we want to make sure that we are taking care of that. Hey, how did you do on this Winning Wednesday? Being a part of this as a routine is going to help fortify what you're doing in the V2 during the week. So these are our last study classes. We only have them on Mondays and Wednesdays. Monday, 12 p.m. Eastern Time. Wednesday, 9 p.m. Eastern Standard Time. So don't miss it. Don't miss it. And as always, you can, you will, and you must pass NCLEX. See you later. Bye-bye.